Hello friends, let's see the anatomy of the gluteal region. In the gluteal region, we have two very important clinical importance, and one of them is the intramuscular injections which are given in the gluteal region. So we should know the site of the intramuscular injections and in which muscle we should give intramuscular injection. One another important clinical term concerned with the gluteal region, it is the Trendelenburg sign. Here the sagging of the hip joint occur due to the injury of some particular nerve of the gluteal region, which will lead to the paralysis of some important muscle and which will lead to the lurching gait or the waddling gait of the person. Now at the end of this session, we are going to see the extent of the gluteal region, important bony landmarks, superficial fascia, gluteal aponeurosis, muscles of the gluteal region, structures under cover of the gluteus maximus muscle, and at the end we should know the clinical anatomy concerned with the gluteal region. So now let's begin with the anatomy of the gluteal region. Superiorly, this gluteal region, it is extended from the iliac crest, and below it is extended up to the skin fold of the gluteal region. This skin fold of the gluteal region, it is not correspond with the lower margin of the gluteus maximus, but it is the skin fold due to the hip joint. On the medial side, this gluteal region, it is extended up to the midline from the spine of the dorsal aspect of the sacrum, and on the lateral side, this gluteal region, it is extend up to the lateral aspect of the greater trochanter of the femur. Now let's see the important bony landmarks in the gluteal region. The most highest point of the iliac crest, it is situated somewhere here, and it lies at the level of the fourth lumbar vertebrae. The posterior superior iliac spine, which is somewhere present here, and this lies at the level of the second sacral vertebrae. The greater trochanter, which is situated around 1 hand breadth below the anterior superior iliac spine, and the ischial tuberosity, which is situated somewhere here, and this ischial tuberosity lies in the line of the posterior superior iliac spine and below the level of the tip of the coccyx. Now let's see the superficial fascia of the gluteal region. The superficial fascia of the gluteal region, it is having the abundant amount of the fat, and it is the most prominent part of the body, and the prominence of this buttock region in the human, it is just because of the adoption of the bipedal gait due to the evolution. This subcutaneous fat present within the gluteal region, it is the one of the example of the Panniculus Adiposus. This Panniculus Adiposus is nothing but it is the presence of the fat within the superficial fascia of the animal. Now let's see the deep fascia of the gluteal region. Before the going into detail of the deep fascia of the gluteal region, let me draw the outline of the two muscles which are present in the superficial part of the gluteal region. One of them is the Gluteal Maximus muscle. The upper border is somewhere like here, and the lower border it is somewhere like this. And one more muscle, that is the tensor fascia lata, which is going to arise from somewhere here, and the outer side it is present somewhere here. And on the lateral most side, the iliotibial tract is situated. So this yellow line is the iliotibial tract. This iliotibial tract from the posterior side, it looks like just a border, but it is a broad band of the tract which is extend from the ilium to the tibia, and that's why the name is iliotibial tract. Here in this figure, we have drawn the outline of the gluteus maximus and the tensor fascia lata along with the iliotibial tract. So the deep fascia of the gluteal region, it is extend from the iliac crest, outer lip of the iliac crest, and it is going to split two times within the gluteal region to enclose these two muscles, and on the lateral side it is going to continue with the iliotibial tract. On the medial side it is attached with the dorsum of the sacrum. So this is the attachment of the deep fascia of the gluteal region, and the part of the deep fascia situated between the two muscles, it is called as the gluteal aponeurosis, and beneath which the gluteus medius muscle lies. So when we take a horizontal section from here and try to see the section from above, we can find that there are two muscles. One is the gluteus maximus muscle and one is the tensor fascia lata muscle, and this deep fascia of the gluteal region, it is going to cover both these muscles after splitting into two lamina, and in between the two they are going to reunite and form the gluteal aponeurosis. And on the lateral side, the deep fascia of the gluteal region, it is going to continue with the iliotibial tract. So here this is the gluteus maximus muscle, and this one is the tensor fascia lata muscle, and this is the gluteal aponeurosis, and underneath gluteal aponeurosis there lies the gluteus medius muscle, and on the lateral side it is going to continue with the iliotibial tract. On the superficial lamina over the gluteus maximus muscle, this deep fascia of the gluteal region, it is attached firmly, and that is the reason why when we dissect the superficial lamina of the deep fascia of the gluteal region from the superficial surface of the gluteus maximus, it shows so many fasciculations which are attached within the gluteus maximus muscle. Now let's see the muscles of the gluteal region. So the muscles of the gluteal regions, they can be divided into three parts: the superficial layer muscles, intermediate layer muscle, and the deep layer muscle. The most superficial layer gluteal muscle includes the gluteus maximus and the tensor fascia lata. The intermediate group muscles include so many muscles. Out of them, these are the gluteus medius, piriformis muscle, obturator internus, superior gemellus, inferior gemelli, and the quadratus femoris muscle. And the deep layer muscle include gluteus minimus muscle. Along with that, some part of the obturator externus muscle, it is also present, but this obturator externus, it should be deal with the medial compartment of the thigh. So all these are the muscles we are going to see one by one. Now let's see the first muscle, that is the gluteus maximus muscle, and this gluteus maximus muscle, it is the most superficial and the largest muscle of the gluteal region. Before explaining the origin of the gluteus maximus muscle, let's see the gluteal surface of the ilium having three gluteal lines. Out of them, one is the posterior gluteal line, one is the anterior gluteal line, and one is the inferior gluteal line. And here this is the outer slope of the dorsal 1/3 of the iliac crest. This portion is the dorsal surface of the sacrum as well as the coccyx. And one ligament is situated from the sacrum to the ischial tuberosity, and this ligament, it is called as the sacrotuberous ligament. And here this is the posterior aspect of the upper 1/3 of the shaft of the femur, where the rough area is there, and that rough area, it is called as the gluteal tuberosity. And on the lateral aspect of the thigh, we find one iliotibial tract, as we have already discussed. So all these are the bony orientation of the gluteal region before going into detail of the gluteus maximus muscle. So gluteus maximus muscle, it is a large and prominent muscle of the gluteal region, and it is going to arise from the area behind the posterior gluteal line and the outer slope of the dorsal aspect of the dorsal segment, and from the outer slope of the dorsal segment of the iliac crest. Along with that, it is also going to arise from the dorsal surface of the sacrum as well as the coccyx and the sacrotuberous ligament. So this whole is the muscular origin of the gluteus maximus muscle, and the outline of the upper border of the gluteus maximus muscle, it passes downward and laterally and reach up to the area about 2.5 centimeter above the greater trochanter, the tip of the greater trochanter. And the lower border of the gluteus maximus muscle, it passes downward and laterally and going to reach up to the shaft of the femur, just near to the gluteal tuberosity. Now this gluteus maximus muscle, it is passes downward and laterally and going to insert into two areas. 1/4 of the muscle, it is going to insert over the gluteal tuberosity, while the 3/4 of the muscle, which is going to insert over the iliotibial tract. So the lower deep part, let me outline that lower deep part with a different color. So this lower deep part of the gluteus maximus muscle, it is going to insert over the gluteal tuberosity, while the 3/4 part, including the upper deep and the upper and the lower superficial part, they are going to insert over the iliotibial tract. So this is the outline of the gluteus maximus muscle. Now the gluteus maximus muscle, it is going to supplied by the inferior gluteal nerve, having root value of the dorsal division of the ventral rami of L5, S1 and S2 spinal nerves. The blood supply of the gluteus maximus, it via the superior and the inferior gluteal vessels. The details of these nerves and vessels we are going to see shortly. Now let's see the important action of the gluteus maximus muscle. The gluteus maximus having 4 important action. The first and most important action is it is the chief extensor of the hip joint. But this chief extensor effect on the hip joint, it is at the time of the climbing and at the running only, while in case of the walking and the standing, the hamstring muscles are responsible for the extension of the hip joint. The second important action of the gluteus maximus muscle, when this muscle get contract, the upper fibers, they are responsible for the abduction of the hip joint. This muscle, it is also responsible for the lateral rotation of the hip joint when the whole muscle get contract. So the lateral rotation of the hip joint, it is also one of the action of the gluteus maximus. And the most important action of the gluteus maximus is the action of the paradox. This action of the paradox is nothing but it is the active controlled lengthening of the muscle fibers of the gluteus maximus at the time of the sitting from standing position. So this is all about the important action of the gluteus maximus muscle. The structures under cover of the gluteus maximus muscle we are going to see after all the content of the gluteal region we are going to cover, but the 3 important bursae are present under the gluteus maximus muscle, and these 3 important bursae, out of them the first one, it is situated between the gluteus maximus and the ischial tuberosity, and that bursa, it is called as a ischial bursa. The second bursa, which is situated between the greater trochanter and the gluteus maximus muscle, and that bursa, it is called as the trochanteric bursa. And the third and important bursa, which is situated between the gluteus maximus and the vastus lateralis muscle, and that bursa, it is called as the gluteofemoral bursa. So this is all about the gluteus maximus muscle.